Hi, this is Dr. Robert Nucci from Nucci Medical. We're trying a little different background for a minute here with our screen. So we're doing Aurora Borealis. It was better than some of the other ones. We'll turn that off in just a second. We're trying things. He had me as a kitten or something a few minutes ago. That didn't quite work either. But anyway, I'm Dr. Robert Nucci from Nucci Medical. You can turn off the Aurora Borealis now. Thank you. And we're going to be talking about recovery time after spine surgery, and sort of grouped together neck and back surgery because people sort of think of them, together after spine surgery. As most things in medicine, the answer is, it depends, right? It depends on how long. One of the things we like to have happen is people recover very, very quickly so that they can return to their life very quickly. There's little need from a physiological standpoint to be in pain after surgery. There's pain is necessary. You bang your toe, you're like, okay. Pain is valuable to know. Don't bang your toe. And if you injure your arm or something, you give your time to recover. But pain after surgery, there's no real value to that when people don't want to have pain or disability after surgery. So the minimal amount of time that you can get someone back to their life, the better it is. And so we do procedures in ways that minimize the recovery time so that people can return as quickly as possible. So when you asked how long to recover from spine surgery, the answer partly is we want you to recover as quickly as you can, given the procedure that's being done. One of the reasons that people talk about minimally invasive surgery, that's a sort of a vague definition of what that is. But minimally invasive surgery means that the smaller incision, less time potentially in the operating room, produces less disability from the procedure, and you can recover, much faster. Over time, it's become clear that it's better to have people move and return to activities as quickly as possible. My uncle, interestingly enough, was a orthopedic surgeon in New Jersey. Father was also an orthopedic surgeon in New Jersey too. My uncle was also. And one of the things that he was pushing back in the 60s, 70s, something, was getting people out of bed after surgery and getting them to move. And this was very heretical. He was criticized greatly for this. But that was one of his big things. And now it's common knowledge, commonplace. We all do that. Get you up moving quickly as possible, gets going. But at one point, the idea was, oh, no, just lay around. I mean, just don't until you're completely healed, whatever that meant. So we've realized that getting people back to function quickly is important. So when you're asked how long to recover from surgery, well, with a smaller incision like the endoscopic procedures we do in the low back, they recover very quickly. They're up walking the same day, and they back to light activities in a day or so, and heavier activities even in a couple of weeks. So smaller incision, more likely to recover from the procedure. Neck surgery, you tend to recover a bit faster, all things being equal. A cervical fusion or a disc replacement, that's basic 1 or 2 level procedure, recover it very quickly. People are back to work in the next week or 2. They're back to light activities, and then they're back to full activities in a 6 or 8 weeks. So the size of the incision makes a big difference, and where it is. The neck tends to recover more quickly than the low back. The size of the incision is important because, at least in the low back, neck not as much, at least from the front, but in the low back, a little incision, less tissue damage, less pain, less disability, and you can return to work faster. That's why you do the small procedure, minimally invasive. If you make a big incision and move a lot of muscle around and get down there to look around, it's more disability. You have more pain, you have more muscle swelling and bleeding and so on. So much longer recovery. So when I talk to patients about lumbar endoscopic surgery, and if you needed to know what that is in detail, it's on our website, nucimedical.com. You can look at endoscopic neck surgery and low back surgery. Walking this within right after the procedure, back to light activities, really the next day or so. Same with the cervical procedure, cervical disc replacement. You're up walking the same day, and back to light activities in a week or so. So it depends on the procedure, it depends on the size of the incision, it depends on where it is. But really the goal is getting back as quickly, as possible. What I like to tell patients is we try to do the smallest procedure. By smallest, the most least amount of damage to the body, least amount of tissue damage, least amount of invasiveness. So the smallest procedure, it's likely to give the biggest, effect, the biggest result. So you don't want to do a procedure that's so small it's not going to do anything, and you don't want to do a very large procedure when a smaller one may actually do the job, or do the job almost as well as the huge procedure that requires many, many months of recovery and risks of surgery and so on. So the answer is, when you're asking how long to recover from surgery, you can recover anywhere from 1 day to many months. It just depends on the intensity of the procedure, the size of the procedure, and the person's health. Healthier people recover more quickly. Oh, I didn't show my little coffee for the coffee talks. Coffee. I am drinking coffee. I had it before we started. We were playing with the Aurora Borealis here. I was drinking coffee. So if you had a question, you have kind of procedure, you would ask the surgeon how long, to recovery. And again, the trend is to move people more quickly, return to things more quickly. And sometimes patients, I think, are a little concerned. It hurts to do this. Well, there is some pain in recovery also. So it's better to have some pain generally speaking, and can return to activity than sit around and not move, in which case you'll have even more pain when you try to return, to activity. So the kind of procedures we do now don't usually require many months of recovery. When I first started back, you do some major procedures, it was 6 months to recovery. Try to avoid that now, and at least on most procedures that we do commonly, it's much shorter, than that. Now, that being said, there's some reconstructive procedures. People have had multiple surgeries, they're in major accidents. That's a different story. I'm talking about more primary things that first-time person had a procedure, the common things that we do in spine surgery for the neck, which are disc replacements and fusions of 1 or 2 levels, low back, disc surgery, this kind of thing. Even the fusion procedures we do now, people are moving much more quickly. So it does depend, but the goal is to get you back as quickly as possible, because it doesn't do anyone any good. Patient number one, and everybody. It doesn't do anybody any good to have you a patient in pain and disabled. We want you not to be as disabled as possible and return to work and life as quickly as possible. It's better for everything, for your health, for your life, and so on. So that is the goal. So that was a sort of a broad way of answering a very difficult question that I'm always asked. But get up and move is probably the answer most of the time, and that's what we want you to do, generally speaking. And that, I think I talked and talked. Hopefully I didn't make too much roundabout here, so you got the general idea what the answer to that question is. I think I do have some questions though from the audience, so to speak. Is it about Aurora Borealis? No, it's not. It says, feel free to ask a question. Oh, that's us. Oh, okay, here we have a question. When can you exercise after surgery? It does depend on the surgery, of course, but we want you to return to activities and then return to exercise that you did at least before. Generally, when I talk to patients, they say, well, when can I, go back to lifting weights, for example? After they've recovered, let's say the recovery and generally for a healthy person, an endoscopic procedure is like 2 weeks, let's say about 2 weeks, sometimes faster than that. But they're up walking, as I said, right away. But when they can return to real exercise, generally what I say is, I want you to return to full exercise. Go lift your weights, but I don't want you to do it right away. I want you to do it within the course of a few weeks. So start out, if you lifted, whatever, 20 pounds or 50 pounds, don't start with 50 pounds. Start with 10 pounds and move on up over the course of 2 to 3 weeks to the exercise you did before. If you played tennis, and it's now been a couple of weeks after procedure, you've recovered, you're walking, you're moving. All right, let's start to return to tennis. Don't play 2 hours of tennis, play 20 minutes of tennis and see how you are. And if indeed you're good, then you could advance that. If you hurt a little bit, maybe take a day off and try it again. Returning to activities and exercise is very important. and as soon as possible. The reason we don't tell people not to return to exercise the day after the surgery is, so you say, why? It seems like, why would you do that? But if you think about it, you start to ask yourself, well, why wouldn't you do that? Well, one of the reasons is because when someone is hurting, after a procedure, they're going to use their muscles in their bodies in an unusual way and injure themselves in another way, and injure with the surgery that's done. Once the body's recovered enough, you can begin to return to activities and strengthen those muscles and strengthen your body in a way that's natural, and you're not going to injure something else. So that's why you actually wait afterwards, or why you wait into the period of time where you can begin to exercise normally and not exercise abnormally, such that you throw something else off and you injure yourself in another way. That's, you don't want to have that. So that's a bit of a surgeon preference and understanding of what's been done, but that's the answer to that. So it does depend, but we want you to exercise. How long does the patient need to wear a hard collar after neck surgery? Usually people are put in hard collars after a fusion surgery to your neck. When you have a disc replacement, you generally don't do it because you want them to move, because it's replacing something that's supposed to move. You don't want to have them not move. So you're talking about a fusion procedure. And the reason you want to have somebody in a hard collar after a fusion procedure is you want it to fuse. In other words, you don't want it to move around. Right? If you have broke your arm, you put in a cast so it doesn't move. If it moves, it flops around and it doesn't heal right. So that's the reason for the collar, to stop your neck from moving and to heal in an appropriate position. In general, that's the reason. Generally, patients wear a hard collar if they need one for about 6 weeks to 3 months. We use instrumentation in the neck a lot now that makes the need for a hard collar not as big. So sometimes with a one level in surgery, may not need a hard collar. So some surgeons still do it. A lot of people have moved away from the hard collar because the internal metal holds it in place. But with multi-level, it's a lot of stress on the metal. So you put someone in a hard collar for a period of time to stop it from moving, so it'll heal, appropriately. We do that for the wrist too, arms too. Put a plate on it, still put them in a cast so that it'll stay steady until the bone starts to heal, even with internal fixation. So, but that's the answer. Usually about 6 weeks to 3 months, sometimes longer, but usually by 3 months you're out of the collar. See if we have any other questions here from the audience. I don't know. I'm interested to see if they like or what other things do we? Don't make me into a cat. Make me into do something else. Let's try something else here while they consider other questions. Let's see, anything else of interest here? A little dangerous now with this. I'm going to be under the ocean or something here. Generally, though, if you or not generally, but if you have any other additional questions, please email us. If you have anything that you'd like to ask that you may not know the answer to, like this today, that was not what I was looking for. That was not what I was looking for. In any case, he's voted off the island. He's gone. But thank you for all your questions. I think we're done with our. That's much better. That's a nice Florida picture. Thank you. We'll stop here. It's been about our 15-minute talk. I'll finish my coffee, and hopefully you're able to answer your some of the questions you had in your head. As I said, if you have any additional questions, please email us. We will certainly answer them. And any ideas for any future talks, we'll be happy to answer those also. There's an answer for things. And sometimes we don't know the answer and we have to find out. But many times there's an answer or a good reasoning on why we do even, simple things. So no stupid questions and all good questions. So look forward to talking to you. I don't know when next week. I think we're doing it next week with Thanksgiving. Well, happy Thanksgiving to all. This is our Thanksgiving week. And I think we're doing it next week also. So see you there next week.